Well, greetings. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm going to talk about a bunch of things this morning, but what I would really want to discuss is what pediatric dentists should know. You know, pediatric dentists, they act like they don't have sense enough to learn how to do pediatric orthodontics, and they're the ones that need to know how to do that, because the orthodontics that they're teaching in the school doesn't cover pediatric orthodontics or a lot of this older adult stuff that we'll talk about also. So we're going to try to cover what I feel like everybody that's messing with orthodontics should know as much as they possibly can, and teach as much as they possibly can to everybody anywhere in the world. So let's get going on this case. It's an interesting case. It's got 4 or 5 things, like it's got an adenoid tissue problem, it's got a breathing problem, it has an orthodontic problem with the teeth protruding way out like that, and it's got a fused tooth, and there's just several things wrong with most every case you run into. You're going to run into several things that are absolutely wrong. And a lot of these things people think shouldn't, they don't realize they ought to be corrected. So let's get going on this right now. Let me get this deal. Now, I don't have the first pictures of this young man, but I'm going to show his models right to start off with. And he's got a very crowded condition. I'll show that on the x-rays later on. And also he's got a mouth breathing problem, so the lower arch down here is bigger than the upper arch here. And this breathing problem he has is a tongue thruster, and the tongue is pushing these teeth way out like this, and understanding how we can bring these teeth down and we can pick these teeth back up in this area and reduce this vertical height of the face to some extent. Now let's go to we're going to, either I took these teeth out or else I had an old surgeon take them out. And you take the deciduous teeth out and let this grow to some extent, and then you go in and we're going to get the second bicuspids, so we won't reduce the profile very much, and we'll let the posterior teeth drift into this opening, and he has the beginnings of wisdom teeth back there that we'll show. So let's go to the next view. On the other side, it's the same thing. We'll have to take the permanent second bicuspids out with the deciduous molars, and then we're going to let nature kind of level this out, and we'll pick this up to some extent with actually we use a headgear to bring that back up. This is the most interesting case, and everybody working on children should really know either how to do this or know about it and what can be done in here. Now, you look at the models, this is more narrow. We're going to have to bring it out bigger because he's been breathing through his mouth. And when you breathe through your mouth, your tongue has to be in the lower arch, and the lower arch widens out more than it gets out past where it should be, and you have to widen the upper arch out to get this back to a more normal situation. Now you can see the lower arch is much wider than the upper arch if you look at that like this. And when I put them together, you'll see that also. Now this young guy has a couple of fused teeth, a central and a lateral on the, that'd be the left side of the guy's mouth. No, from my side, it'd be the right side. Okay. Let me clear my throat a little bit. Now, we look at the x-ray and we figure what we have to do. But we didn't take the deciduous teeth out right at first. Now, here is the young man. Now, when you look at the profile of somebody like this, their chin should be out more like that. And so the lower jaw needs to be brought forward to some extent here, and maybe bring the upper back just a wee bit also in correcting the problem here. Now looking at him straight on, the vertical height of the face is not bad at all. In fact, it's okay. There's no problem with that. And dividing the face up, you see that 1/3, these three divided into thirds like that. Now, if we come in here and we already started this, and when I got this picture, we had the bite closed down already. So we're using a headgear to do that. And this is an occipital type headgear. They call it because of the occipital bone on the skull up here. And you're pulling down here. Now watch what the deal goes around like that, and you're pulling up on it over here. So we're going to tend to raise the posterior teeth in the upper arch to do that. And then we'll put intruding arches or open the bite with that. Let me erase this. And everybody ought to know how to use some of these headgears. They are helpful in putting force where you really need it. All right, when we look at his cephalometric x-ray, let's see, did you cover the names, or do you remember what we did or not? Anyway, we go here. Now, he has this open bite. See, the tongue is pushing these teeth out. Should I stop right here? Let's go to pause. Okay. All right, we've got the name covered up. I don't think it would hurt if we knew who this person is. At this time, when I showed the adenoid tissue, you've got to get at the cause for the problem you're having. And this is definitely, the adenoid tissue is overgrown, and it's sticking out in here, something like that. And that put the airway pretty small here. He can't breathe through the nose good, so he breathes through his mouth, and that makes the lower jaw go out. And then he doesn't bite good. He swallows and pushes the tongue forward, and the front teeth go out with that. Just that pressure of the tongue constantly on there. It doesn't widen the upper arch, and it pushes the upper anterior teeth out like that. So we send him to an ENT person, and he's going to go in and take that adenoid tissue out. And probably the tonsils were oversized too, and so they took those, I think, out of both the adenoids and the tonsils, and that clears your airway up quite a bit. So I'm going to erase that, and we'll go on. Now here he's back from the adenoid operation, and this is all cleared out in here, and probably his tonsils were removed down in this area of the mouth. Now we'll go in. Now we look at this, if you just take time to look at the panorex of these people, you can tell whether they were going to be able to accommodate the teeth or not. We've got these 3 teeth trying to get between this space, and they're not going to go in there very easily. Now we've got a little more space down here. That's a lateral tooth right there. We've got to bring these 3 into this space. So we look back in the mouth, and we've got the 6-year molars, we've got the second molars, and here is a wisdom tooth, and here's one. Here is a wisdom tooth over here, and here's one developing on that side. So he's got wisdom teeth, 12-year molars, and 6-year molars, all of them there. So we know that if we have a little space left in here, we're going to have these teeth move forward and close up a lot of that space and make it where it'll fit this young man. So down on this side, we've got that fused tooth right in here, and you can see the cuspid coming up under the baby tooth right there. So we'll go ahead and plan to do this case by taking out his second bicuspids, and that will, in other words, we take this here, and that'll let us bring this forward easier, and it'll prevent reducing the profile to where it doesn't look fullness, has enough fullness as it should have. Let's go in here now. All right, we get him back again, and we had to widen the upper arch out, so we put a palatal separator, and we spread the upper arch out with this palatal separator. You can see it going across here. It has something, and it separates it, pushes these teeth out on the upper, and widens the whole upper arch up there. So now, after it gets out there like we wanted, we take the palatal separator out, but then we recommend removing these teeth. Now you can come in, and there are 2 ways to do this, 2 ways to take out teeth that are down underneath here, like this. The first thing, you take away the deciduous teeth, and that, well, in this case, he had lost this one, so we just had to pull the bicuspid out without any problem. Now, getting these bicuspids out, I'm going to kind of change and make a little view here how we do this. We've got a deciduous tooth here, and we've got a bicuspid coming in up underneath this tooth, like that, a big bicuspid. And what we do, we get rid of this, and then we come in and grind down through this tooth and stick a spoon in this area. And when it's broader, we twist that, and this tooth doesn't have anything holding it in very much, and it'll just slide out through that opening to that. And that's what we did if we did it that way. And I could send him to an oral surgeon, but a lot of these cases like this, we would go ahead and do that. Now let's go back here. So let's see the next thing. We came in and took out the deciduous teeth, and we took the permanent teeth out too. See, so the permanent tooth's gone and the deciduous tooth too. So we got one bicuspid, and we got cuspids, first bias, second bias gone, but we've got the wisdom teeth back here if we need to use them. Use the wisdom tooth. All right. We went through that process, and we had headgear on this young man. Let me see if we elevated these teeth. Right here we took them up by pulling these down. It would put a force to pick these teeth up back here. And so we brought the upper anterior teeth, these four across here, down, and the bottom was pretty well straight to start with. So here we put something in to train the tongue. You see these little deals here, and this was a fused tooth, so we just used one deal off of it to train the tongue to stay in the mouth. Now we're going to give it plenty of room to function and everything in that fashion. Now we've got the first molars here, the second molar, and here are the wisdom teeth trying to get in. I don't think I've got a picture of that, but there's room for those wisdom teeth to come in. At this point, he's 12 years, almost 13 years old. So we didn't do all this at one time, just gradually do this. So it takes several years, though you just work a good bit here earlier, and then you gradually do things that need to be done as the person develops. And that's why I say the pediatric dentist ought to know how to do these things and not depend on the orthodontist to send him over to get little things done in between times that where you go and do a whole bunch of work. Let's see, okay, now the second molars are in the mouth, and they're hooking up real good with the teeth above. This bicuspid will come in here and here, like that. All right, here he's age 13 and 7, and we've still got him in the braces. So we're going to probably finish this young man and leave his wisdom teeth to come in. You don't want to stay there till he's 17 or 18 years old with wisdom teeth, so you come out. And you may have to come back and upright them and get them in place, and that's all right. Come back in after he gets 17 or 18 and do that. So let's see what turns out here now. He is 13 years and 7 months old at this point. Now this is at age 14 and 5, and this is the 9th panorex, and the wisdom teeth look like they're developing fairly good, and we've got the rest of the teeth lined up in here, and everything looks perfectly fine. And the fused teeth we used as one big tooth in there, and we trained his tongue, and we got that back, got his teeth lined up good again. Here we we drop back with the brackets and the arch wires, and we've got what looks like a rectangular wire up here, bringing these teeth in place, holding this space open. Down here we've got a round wire that's doing a whole bunch of work. It's rotating all the teeth, leveling from tooth to tooth, and doing things that those teeth need to be done, all of them at one time. So it's a lot faster than staying in the mouth all the time in some of the cases. Okay, let's find, go ahead and finish this case out now. We cut the palatal separator off here and took it out, and then took the teeth, the second bicuspids came out with that, and now we're waiting on the cuspids to erupt into the mouth. Now here was the palatal separator. We cut it off back here. It was fitting on the deciduous teeth. Now those deciduous teeth are gone too when we finish up. Now the fused teeth, we put one bracket on it and we pull this around and rotate it. We push this back and pull this at the same time right there. Let's go ahead and finish this up. The fused teeth, we're going to rotate that a little bit and we'll get them lined up. Now this is the headgear. It was hooked out here and we were pulling over on this side, so we elevated these teeth right here, and then we had a intruding arch that was bringing these teeth back. Instead of intruding, it was extruding the upper anterior teeth. Now here's the way this worked. In other words, we widen this out so that the upper teeth are fitting over the lower teeth. You see, they're not here. And then this went up, and you don't have to go in and do surgery or anything on this. Let nature, you get at the real cause of what is gone wrong to start with, and nature tends to level the teeth out like that. But we had an arch wire back here that would probably be down here, and we brought it up and hooked it to these teeth, and then it'll tend to push them down, and it pushes this up a little bit to level it out. Now if we come in, let me erase that. Now this is the way this is. You see the upper teeth that line out here. Over here, these aren't in as much as the upper was on the other side, but the teeth are out here broader and fit over this, and now these teeth down in the midline is right on at that point. And the laterals are in and the cuspids, and now you go to the next deal, and you look at this, and you didn't have some of this cuspid hadn't come into place quite good enough yet. Now, here we look at the way that fits together, the way this upper fits in there. it doesn't hurt to understand exactly what's going on. But I bet if I didn't show this to several people, they'd think this was just two teeth. But this is a fused tooth right here, see? And this is the way we finish this young man up. And we're waiting on the wisdom teeth. They'll come in, but we don't have to sit around and wait till he's 17 or 18 for them to come in. If they come in a little wrong, you can go and upright them, but usually they're going to be doing pretty good. So these are out. That's the permanent tooth. So this tooth moves up into this space, and we've got the cuspid and the first bar, and then fitting in here, and this moves the rest of the way into place. So here is the young man that's smiling, and you can see the teeth right behind that, and it was kind of, this is where the chin needed to be out about like that, and that's about where we got it, and that's the end of this video. And what I wanted to say in here, that when you learn something, try to pass it on to as many people as you can. I am grateful that I didn't get to go to orthodontic school, because I would have been taught things that were not actually the facts at that point. It was what people thought they were the facts. Like they thought that adults' teeth couldn't be moved up here. And I didn't know that, so I just went ahead and moved them. And they do move good. And so we could do all kind of adult orthodontics today. And back then, they said they couldn't take care of that God gave you all 32 teeth there, and that's can take into consideration the people that in the United States or all the mixed areas of the world have huge, large people. They may marry somebody who's smaller and more delicate, and the teeth of the large person can be in the skull and the development of this child that they might have. And there's not room in there for those teeth to be there. So it's ridiculous to say that we don't extract any teeth at all. That's a foolish thing to say, because you need to get the teeth to fit the skeleton that you've got. And you feel like this young lady was that good. We actually use the teeth from her actual oriental, her things. We took teeth out from that and finished it up. And so we've got a real nice result in this case. And this young man will spend the rest of his life with a very nice, winning smile, which if he had had his teeth sticking like that, there was no way he could accomplish what he can if the teeth are straight and lined up and has a good smile like that. So I thank you for watching, and I'm going to close out and say goodbye, and thank you for keeping up with our business. We're trying to inform everybody anywhere in the world how to do orthodontics and what is wrong and why we weren't able to do it. So I'm going to close out. So I'll say goodbye and do that. Thank you now.